Good morning to you all. On behalf of the Focus on Sickle Cell Foundation, myself and the directors, management, volunteers, I sincerely thank you for honoring our invitation for such a short notice. I stand before you today not only as the founder of the Focus on Sickle Cell Foundation, FoSCel, but as a young person living with sickle cell disease. This advocacy is not just professional, it is personal, it is purposeful. My life has taught me one clear lesson: knowledge protects life. Early awareness changes destiny. This is why FoSCel exists: to educate, to advocate, and to support without silence. Today, our engagement here serves two important purposes. First, to commend the government of Ghana, particularly the Ministry of Health, for the historic launch of the National Sickle Cell Strategy 2024 to 2028, and also the National Sickle Cell Disease Screening and Case Management Guidelines, which were just launched on the 16th of last year, December 2025. Initiatives such as free sickle cell treatment. Second, FoSCel is using this platform to formally present a policy proposal advocating for the integration of sickle cell education into Ghana's JHS and SHS curriculum. And this is aligned with the already existing national policy. That is the National Sickle Cell Strategy, which was launched by the Ministry of Health. And our priorities is to educate, is to create awareness and early intervention. FoSCel's contribution is to demonstrate how this education can be delivered practically within our schools. We have a national contest. In Ghana, about 2% of newborns, nearly 18,000 babies, are born with sickle cell disease every year. These are not status. These are children. These are families. These are futures. Yet, many students complete schools without understanding what genotype is, how sickle cell can be inherited, and how informed choices can prevent suffering. And education. Too many children face avoidable pain, stigma, and complications. While treatment saves lives, we believe education prevents pain before it begins. While the national strategy provides policy direction, FoSCel's research, field experience, and community engagement focus on classroom practice. We call this the Catch Them Young approach, introducing age-appropriate sickle cell education at the JHS and SHS levels, so students grow up informed, empowered to make reasonable health decisions. This approach completes national policy by preparing young people to know their sickle cell status before marriage or parenthood. To support this vision, FoSCel has developed an original sickle cell comic strip education model using storytelling and illustrations to simplify genotype inheritance, early screening, prevention, and stigma reduction. This model has piloted in schools, churches, mosques, and communities in the Efutu municipality, Winneba, and beyond, with strong positive feedback from students and teachers. For many young people, it was their first structured exposure to sickle cell education in a relatable format FoSCel therefore proposes that if our comic strip is being adopted by the Ministry of Health, Ministry of Education, Ghana Education Service, this comic model can be scaled nationwide to support implementation of the National Sickle Cell Strategy 2024-2028 in our schools. Whilst the nation is waiting to hear this feedback from the Ministry of Health in collaboration with the Ministry of Education, we can still take a bold step by taking this comic strip nationwide to prepare the foreground for our students to know their genotype. And before the integration of the curriculum even starts, at least those who are already in the schools about to complete will know more about sickle cell through the comic strip model. Over the past month, FoSCel has worked diligently to power communities through education, awareness, and screening. We have organized a national programs at the University of Education, Winneba, during the World Sickle Cell Awareness Day 2025. Conducted awareness section in schools, churches, mosques, and community spaces. We have also collaborated with local health centers for screening and referrals. These interventions demonstrate that school-based education is a powerful tool for breaking mind, promoting informed choices, encouraging early screening, reducing stigma. In conclusion, FoSCel envision a Ghana where students make informed health decisions. Families are protecting through genotype awareness. Communities respond with empathy, and sickle cell warriors live with dignity. In fact, a lot of sickle cell warriors in our schools today are facing unbearable stigma just because the concept of sickle cell disease is missing in our curriculum, of which we have a lot of health-related topics which has been inculcated already in our curriculum. This is such as HIV and AIDS, malaria, reproductive health, and more. But sickle cell disease that affects over millions of people across the globe, thousands of people in Ghana. As I said earlier, 18,000 babies are born every year living in sickle cell condition. You can imagine a 3-year-old sickle cell warrior is being diagnosed as having stroke. Sometimes we have hip problems, organ damage, just because of this issue. If we can teach a condition that is being treated through behaviors, then we can also make Ghana Education Service aware that sickle cell disease can be still inculcated and be taught in our schools. This is very simple. Also propose that the comic strip already has more informative and that information to make sure that people learn through visual to understand sickle cell disease. Today, we respectfully call on stakeholders to support this integration of sickle cell education into our school system in partnership and alignment with national sickle cell policy. Let our classroom teach what our hospital treats, we say. Let knowledge become our first medicine. FoSCel is ready to contribute research, tools, community experience, and we believe together we can ensure that Ghana's sickle cell education moves from policy to practice. And this is what we are yearning for. We thank the media for amplifying this national call and not being taken seriously in our nation. where will our future be? We have a lot of sickle cell warriors like myself who has a vision to become president, vice president, member of parliament, doctors, nurses, and imagine a whole president living with sickle cell condition. How can this nation move forward? I ask again, imagine a sickle cell warrior is a medical doctor. Just imagine how will patients in our hospital have a very, very treatment that will help them to cure their condition. But still, sickle cell warriors have vision. For us not to make this condition unbearable for innocent sickle cell warriors, let's prevent it by educating our youth to know their genotype before they set in giving birth. Because sickle cell disease is very, very powerful condition that destroys families. The stigma attached is not easy to sickle cell warriors. The medication is so expensive. We also stand on this platform to thank the Ministry of Health are facing this challenge. In fact, let's think about sickle cell warriors who have managed to grow up like myself. I'm a professional journalist, and imagine, as a journalist, how much do I have? But even being a journalist, the salaries that I take, it will shock you that before the month ends, I spent all on medication just because I live with sickle cell disease. And I stand in the gap to propose all these policies and proposal to the Ministry of Health and Ghana Education Service to consider. At least, we don't want this to happen in our near future. We want a Ghana where our healthy children are taking over. If we are bringing forth a generation that are always sick, meaning where is this nation going to end? So please, we are here. On behalf of sickle cell warriors in Ghana, I plead with government to also help us to make sure that the treatments, as the Minister of Health said, is being inculcated ready in the National Health Insurance Scheme as we are expecting. We thank you for giving us this privilege to at least tell the nation or inform the nation about what is happening in our education system. Thank you.